I'm Dr. David Sarwer. I'm the Associate Dean for Research and Director of the Center for Obesity Research and Education in the College of Public Health at Temple University. And last week, there was an interesting letter to the editor written in the Journal of the American Medical Association. And this letter seemed to suggest that the percentage of Americans who are actively trying to lose weight at this time has decreased from where we were several decades ago. That back around 1990, more than half of all Americans said that they were actively trying to lose weight. And the most recent findings suggest that that percentage has now fallen less than 50%. Now, this is a surprising finding, particularly against the backdrop of the obesity problem that we currently have in our country. As most estimates suggest that approximately 1/3 of Americans are clinically obese, with a body mass index of 30 or greater, and that another third of Americans are clinically overweight, with a body mass index between 25 and 30, suggesting that these individuals are at risk for the development of obesity in the future. And as a result, there have been a number of survey studies of Americans done over the years suggesting that many individuals are working hard to try to lose weight and control weight gain in the future. And it's against this backdrop that this most recent finding is somewhat surprising. Now, the authors suggest that one interpretation of these results is that simply as the scope of the obesity problem has become larger, people have become more or less satisfied with being overweight or obese. Now, this interpretation is a little bit curious because we know that body image dissatisfaction is a significant issue for many Americans, and that for many of them, the feature of their appearance that they're most dissatisfied with is their body weight. We also know that, counter to intuition, that being unhappy with your body weight isn't necessarily going to motivate you to lose weight. Because a number of studies over the years have suggested that if we make people more unhappy with the way that they look, that will somehow change their behavior and help them lose weight. While that makes a lot of intuitive sense, there's no scientific research to back it up. Another possible interpretation, however, could be that for some individuals, they've simply got diet fatigue. That after years of trying to lose weight, and unfortunately without long-term success, they've simply grown tired and are simply at this point in time telling the researchers that they're not actively trying to lose weight. Regardless of which interpretation you think may explain this finding, I think there's a larger take-home message here. The reality is that against the scope of the obesity problem that we now see, that almost 70% of American adults have issues with their weight and could benefit from a health perspective with weight loss, it's important for all of us to be diligent and conscientious about the choices that we make around our eating behaviors and food, and that we look for ways to increase our level of physical activity, to be as physically active as possible. The unfortunate reality is that over the last several decades, we've allowed for the development of what's known as a toxic food environment, that the contributions of less physical activity and the availability of high-calorie and high-fat foods are one of the primary drivers to the obesity problem that we currently have today. And that if we're actually going to reverse this trend and perhaps make headway on the prevention of obesity in the future, the reality is that all of us need to be conscious about what we eat and how much we exercise.